colleague of his. She is assistant professor at the University of Arizona in Tucson, graduate of the Osteopathic Medicine College in Chicago, and training at the University of Southern California. She has done many things, in part in collaboration with Dr. Mesa, and is very interested in integrative medicine, obviously a developing field. And some of what we have heard, particularly from Dr. Mesa, certainly fits and heads in this direction as well. So, as I said, we will have a recorded presentation by Dr. Gowin. Can we proceed, Lee or Julie?
Welcome. Good afternoon. And I want to say thank you so much for the invitation to participate in today's program. I am extremely honored to be part of the program amidst all of the distinguished speakers that are on the calendar for today. It's amazing. And I want to express really sincere gratitude to the organizers of this meeting to include this important topic about wellness, because I think it's just so important to have this to fuel and empower your journey. So thank you so much, and let's get started. So I'd like to invite you to participate in a visualization exercise with me and to truly think about, what does wellness mean to you? What does your optimal health truly look like? And if you can, because this is virtual and you don't have to be shy and embarrassed about closing your eyes, nobody's judging you, close your eyes for a minute and take a deep breath and really visualize your optimal health. What does your body feel like? What does it look like? What are the thoughts that you want to be carrying with you? Who are the people that you want surrounding you? What is your purpose and your meaning? And how are you fueling your everyday with joy? And go ahead and just spend a couple of moments there, envisioning what that is. And if you have a piece of paper and a pen, go ahead and jot a few of those ideas down. Those are your goals. That is your optimal health that you're striving for. And it's helpful to know the end goal as you're embarking upon your journey. It will help to guide you and steer you. But the truth is that you're dealing with a disease. You have either myeloproliferative neoplasm, MDS, aplastic anemia, and PNH. All of these share the united kind of issues of potentially having symptoms of not feeling your best self, of potentially being on some sort of therapy that's giving you side effects and toxicity. Perhaps you're transfusion dependent. And so it's really hard when you're in the midst of all of that. You feel kind of like you're underwater. You can't catch your breath and you can't get up and over these hurdles to truly get to that optimal health. So what I'd like to do today is to throw a life preserver out for you and to give you some wellness tools to hopefully help you to float back up to that surface and to give you another sense of control of your environment. So our objectives today is to discuss what is integrative oncology. And so that life preserver that I was talking about really is really the tools within integrative oncology that can help you through this journey. And to discover why integrative oncology is important, to review lifestyle medicine interventions and what you can be doing to optimize your health, to emphasize the care of the mind, of fostering meaning and joy, and to consider some of the complementary care modalities that are out there that potentially can support you. So let me read this integrative oncology definition to you so you can truly get an appreciation of what this field is. Integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and/or lifestyle modifications from different traditions alongside, and this is key, and this is what differentiates integrative care from alternative or complementary care. It is alongside conventional cancer treatments. Integrative oncology aims to optimize your health, quality of life, and clinical outcomes across the cancer care continuum, and to empower you to prevent cancer and become active participants before, during, and beyond your cancer treatment. So I really love that definition, and the only change I would make is it really should say and lifestyle modifications, not or, because that's key, and we'll talk more about that. I like to talk about these 4 pillars of wellness. And the 4 pillars, to me, in my view, is body, and talking about, again, the lifestyle medicine techniques that you can employ. It's care of the mind and stress reduction. It's fostering joy, which is promoting happiness and a sense of gratitude. And then meaning, and that can mean many different things to each one of us, but having a sense of connection to something greater than yourself is truly powerful medicine. But again, this is all around this central theme, unifying theme of what is conventional medicine, right? That's the allopathic Western model. And so it all comes together in this integrative model. And then you have the complementary modalities speckled around the side. And again, what I love about this is you have the power to promote your own wellness in this model. You are dictating your therapies, which is nice to have that sense of control again. Why is it so important? Well, we know that there's unmet symptom needs, and I've worked a lot with Ruben Mesa on MPN quality of life, but this is also true for every single cancer out there, that there are symptoms which are there and present and are sometimes not alleviated by our pharmacologic model or medications. We want to decrease inflammation, and we'll talk more about inflammation. But inflammation truly is a driver of disease, a driver of symptoms, and a driver of poor quality of life. And so by truly targeting the inflammatory cascade, if you will, you're really getting to the root cause of what is driving the things that you wish to cool down. Desire for and current use of complementary modalities. So most of you are already doing something in this wheelhouse, and the survey data really shows that most patients want to be employing some sort of integrative medicine into their treatment plan. What we hope is that there's a potential to impact your disease outcome and decrease your disease toxicity, or not disease toxicity, therapeutic toxicity, and to decrease cost of care. So if you're feeling better and if there are lower side effects from your therapy, hopefully the financial burden will also go down. And we're looking into that as far as some research projects. So let's get to this idea of tumor-promoting inflammation. And on the right side of the screen, you'll see all of the different mechanisms that are truly driving cancer and cancer biology. And one of them, this was recently updated, and I shouldn't say recently because it's been several years now. There's a couple different renditions, but the newest rendition really talks about this core idea of inflammation. And so what does inflammation come from? Lots of different things really play in together to fuel this biologic cascade of inflammation: chronic infections, obesity, smoking, alcohol, even environmental pollutants, high-fat diets, processed foods, et cetera, et cetera. All of these different things can fuel inflammation within your body. But what I'd like to highlight here is these are all modifiable. These are all things that you have control of. And that's a really powerful thing to appreciate. So what about some of the diseases specifically. In myeloproliferative neoplasms, we know that there is a heightened level of inflammation going on within the system. This is seen in ET patients, PV, and very pronounced in MF patients. There's these cytokines, and what do I mean by cytokines? These are all these signaling molecules in your body that says that there is a stress response and inflammatory response. And we measure those in the bloodstream by a few different ways. We can look at things called tumor necrosis factor, interleukins, CRP, lots of different ways to look at this inflammation. And that has been shown that that's heightened in MPN. And what I'd like to point out is that inflammation actually correlates with MPN disease outcomes. So as you know, one of our major targets in MPN is really decreasing the risk for blood clots or major thrombotic events, things like heart attacks, strokes, etc. So with high levels of inflammation, you're actually getting more of these events, these major thrombotic events. So increased risk with inflammation, as well as a shortened, smaller leukemia-free survival. And so that's also really powerful information to kind of take in and know that we potentially can be modifying that. Also true in MDS. MDS is associated with an inflammatory cascade. And in a recent JCO article in Journal of Clinical Oncology, this was even proposed as to be so important that it needs to be integrated into how we prognosticate and stratify our MDS patients. And so if you have MDS, you may have heard of something called an IPSS score. And so perhaps it's beyond all of those features that we include in that IPSS, but also part of the inflammation cascade and how is that changing over time. And with more inflammation over time, is that predictive of a higher risk of transformation to acute myeloid leukemia? So it's just, again, speaking to the power of inflammation and the importance to really cool it down. So how are we going to do that? What are some tools that you can put in your tool belt to help you cool this inflammation cascade? And it's really lifestyle. That's the backbone of good integrative care, is looking at your diet with a microscope, taking a hard look and saying, what am I truly putting in my body? And it's interesting, once you really pay attention and maybe even journal, you're surprised sometimes of what's going in and then what's not going in. What are you lacking? Exercise as well, so important, and we'll talk more about that. I love this picture because it is so colorful and it's vibrant and it shows the rainbow of foods. And with all of the rainbow of foods, you get different phytonutrients. It's really those phytonutrients that are giving the color, imparting that beautiful vibrancy to food. And with every different color spectrum, again, there's different nutrients that work together that are anti-inflammatory. Hippocrates knew this long, long ago. He was way ahead of his time, and he said, let food be thy medicine and medicine be thy food. And I think that is so true. And I think we're coming back full circle to appreciating the importance and the power of what diet can do. Some of our largest true randomized data, kind of the hard science of diet and inflammation, comes from that within the cardiovascular disease research. And this is called the PREDIMED study, and it's over 7,000 patients with high-risk cardiovascular disease. And they asked them to partake in this trial in which they consumed Mediterranean-based foods, right? Lots of fatty fish, leafy greens, olive oil, nuts. And they then asked them to supplement with either more olive oil or more nuts. And this was in contrast to a low-fat dietary control group. And what they found in this study is that those with the highest quartiles of the healthy foods, these healthy Mediterranean components, had lower incidence of major cardiovascular disease outcomes like heart attacks. And so you can really appreciate in that green line on the very bottom of the slide with the highest quartiles, again, of that Mediterranean diet, the incidence is much, much lower than that kind of red curve that you see at the top with a higher incidence of these poor outcomes. So really powerful data here that diet can change the cardiovascular disease outcome. And this is also important because they looked at some markers of inflammation, CRP, and this was done in many other studies as well. And it was lower. And so by diet alone, you're really modifying this inflammatory cascade. So important, and I always share this with my own MPN patients because, again, what we're trying to do with some of our therapeutics, say with hydroxyurea or ruxolitinib, is we're trying to get some disease control, the cytoreductive control, hematologic control, but what are we really trying to do? We're trying to decrease your risk for blood clots more than anything, and especially in PV and ET. So with diet alone, my goodness, this potentially can impact that. And we're looking at that. And there's going to be ongoing trials looking at the Mediterranean-based diet in MPN patients. But again, looking back at what we just talked about in MDS, and it is also true in almost every disease out there, cardiovascular disease, diabetes, et cetera, Alzheimer's, autoimmune, inflammation is the driver. So getting to that root cause with diet, very low toxicity therapy makes a lot of sense. A lot of other interesting things with diet, which we do not have the time to go into today, but there's interesting data about intermittent fasting or time-restricted feeding, and how does that change your cardiometabolic health? Interesting data about ketogenesis and how we really exploit something called the Warburg phenomenon, where our cancer cells really like to use sugar preferentially and have a hard time with ketone metabolism. So there's lots of randomized trials now looking at that, as well as the microbiome, which is this balance of good and bad bacteria. And so all of these different strategies potentially can impact your health, and we need more data to better understand how we're going to integrate it. But for now, my recommendation is whole foods, Mediterranean-based diet, anti-inflammatory diet. What about physical activity? Another beautiful complement in this lifestyle intervention is diet and is exercise. This is the core. And every one of us will have a different ability to partake in this. And so the first step is to really evaluate, where are you? What can you truly do? And what are some incremental kind of baby steps to get towards a healthier lifestyle and a healthier activity level? Lots of data, particularly within the breast cancer population, the prostate cancer, colon cancer, large observational epidemiologic studies that show significant impacts on cancer-free survival as well as overall survival, decreases inflammation, obesity, and stress. But we need more data, particularly disease-specific data. So we know that the optimal dose may be different in breast versus colon, which was really interesting. That came from the Nurses' Health Study, where they looked at thousands of patients and the incidence of cancer, and they found that the sweet spot of exercise was different between these two different diseases. So I think that really highlights, again, we need more knowledge to know what's the best kind of exercise, the frequency, the intensity, the so-called exercise prescription. But the bottom line is there's no wrong way to move. So just see where you're at, start moving, seeing if you can integrate all of these different kinds of movement, cardiovascular, strength, as well as flexibility. And here's a few different recommendations. The American Cancer Society recommends 150 to 300 minutes of moderate intensity, or 75 to 150 minutes vigorous intensity per week. And then there was this really nice meta-analysis that was done several years back now in breast cancer. But it again highlights that we want to use all of these different modalities, the cardiovascular strength and flexibility, to optimize your physical health. There is truly a paucity of data in the hematologic disease patient population. There are some interesting articles out there in lymphoma where patients who were on chemotherapy and they underwent an exercise program were able to maintain their chemotherapy intensity, meaning what is the dose, and then also the frequency, where they were staying on time and not getting the same dose delays as those that were not participating in physical activity. So again, just speaking to the importance of moving even while on systemic therapy and having active chemotherapy, get moving, but listen to your body and be intuitive with what you're doing. We did do a trial looking at a form of meditative movement, yoga, in myeloproliferative neoplasms, where we randomized patients to an at-home yoga program versus a waitlist control. And we asked them some surveys about what would their quality of life look like, their MPN symptom burden, but as well looked at some of the systemic markers of inflammation that we had just been talking about, tumor necrosis factor alpha and IL-6, as well as some cortisol time points. And what we found is that in our 62 patients that were enrolled, they averaged very little yoga, to be honest, per week, 40 minutes per week. But despite that, there was a significant decrease in the tumor necrosis factor alpha, the marker of inflammation, from baseline to week 12. And then there were some, what we call in statistics, effect sizes. That's what we do when it's a very small sample size, for sleep disturbance, pain intensity, anxiety, and depression. And so that was a really unique study done with ASU, Jennifer Huberty, Ruben Mesa, Mayo, now at San Antonio. And hopefully this will go on to further randomized studies looking at yoga and MPN, and then hopefully MDS, PNH, aplastic anemia. I think all of these different diseases would benefit from a meditative component of their exercise regimen. And I'm currently doing research in Tai Chi, which is also, a meditative movement. And so anything that incorporates the breath and movement, I think is phenomenally powerful, because you're hitting multiple mechanisms at the same time. So all of the time we've had so far together has really been focused on body in our first pillar and that lifestyle medicine component. But what about care of the mind, fostering meaning and joy? And I would say that this is a really powerful category. And we see in human and animal models is that stressed animals actually are building tumor cells at a faster rate. They're metastasizing at a faster rate. They're building more blood vessels. And we can measure that with what's called a VEGF stain. And so there's more VEGF staining. And we actually use that in a lot of our cancer chemotherapy regimens. We block that VEGF pathway. So long story short, stress can really change the microenvironment of the cancer cell. Those stress molecules, norepinephrine, epinephrine, cortisol, can really feed and change that microenvironment in a poor way, and that's fostering poor outcomes. So important to check in with these different pillars, to check in with your body and your mind, and see, are you holding on to stress? And if you are, if you identify these, and it takes work to truly start to begin on a daily basis to recognize your stress patterns. But once you recognize them, to have these tools and these methods in your back pocket to pull out, to release that stress pattern that you find yourself in. So I like to teach something called the 4-7-8 breathing technique. And there is a YouTube video on this. It's the Andrew Weil 4-7-8 breathing on YouTube. He does a really good job of it. And you can see on the handout just how to do that. But let's do it just one cycle together today. And so go ahead and take a deep breath. Close your eyes. And just kind of sink into the practice of breathing. And what I want you to do is to breathe in deeply for the count of 4. And I want you to hold that for your count of 7. And then breathe out fully and intentionally for the count of 8. You'll notice you really have to breathe in deep for that 4. So let's try that again. Breathe in for 4. Holding for 7. And out for 8. And so even with that one simple breathing pattern, you can notice feeling relaxed immediately. And I will say it's a learned response, meaning the more that you practice it, the stronger that tool becomes. And so what I encourage you to try and experiment with is to do this first thing in the morning and do it at night. And to then any time that you find yourself in this stress pattern to pull it out and to use it again. And after several weeks of use, you'll really notice dropping into that relaxation response. I also like to give homework in fostering joy. And my patients will always say that I love to give homework. And so I give this breathing exercise, I give these joy exercises, they journal their food and their diet. But joy is a really fun one. And so joy is about really taking a moment, identifying what makes you feel light and alive, and then having an intention every day to be in that space. So you name your joyful intention, you do it, and I like to say 5 or 10 minutes, just once per day. And then you reflect back and you have gratitude for that joyful experience. And I like to assign, again, that kind of practice every day. So I encourage you to experiment with that. Meditation can be very powerful. And there's many different applications out there that can assist you in this journey. Calm, and we actually have some pilot data, and now there's actually further ongoing studies looking at meditation in MPN patients, but it's true across the board. And so there's, again, Calm, Headspace, Insight Timer. You can try these different applications to help you on your journey. What about all these different complementary care modalities? And I think it really is about finding something that resonates with you. And so know that there's just a million things out there, right? There's Reiki and craniosacral therapy and acupuncture and Ayurveda and et cetera, et cetera. And so it's about opening up, trying to evaluate what resonates with you and experiment a little in a safe way. One of the most powerful complementary care modalities I have found is acupuncture. And we know that it's safe and effective. There's mounting data, particularly for breast cancer and control of some of the achiness that you can get with some of the therapeutics called an aromatase inhibitor. A really beautiful randomized trial to support that it decreases the arthralgias associated with that. But there's in many different disease states mounting evidence of its safety and efficacy. Best data, again, for pain and nausea, can be effective for fatigue, for sleep, for smoking cessation. Interestingly, so important to be getting control of your smoking addiction if you have that, because that really drives inflammation. So acupuncture can be very powerful for that. And they actually had a summit for this in 2016 where they asked 19 different scientists to weigh in, and they, again, supported its safety and efficacy. I personally get acupuncture once per week just for general wellness, and it has been amazing. I love acupuncture. Botanical medicine, this is a hot topic, always a lot of questions about botanicals. And I would say that we could spend several days in of itself speaking about botanical medicine. What I'd like to do is just give you a few resources today where you can investigate what are the different botanicals out there, but most importantly, to investigate their safety and to investigate if there are any potential drug interactions that can occur with some of your systemic therapies. So the Natural Medicines database actually offers the interaction function where you can put your chemotherapy in, put the botanical in, and it will run for the most common reactions and give you the different research articles that support that. In general, we need more data in this space, and we need to better understand drug interactions with our botanicals. And there's actually a lot of issues with botanicals, the source and potential contamination, pharmacologic interactions, which I just spoke about, potential safety, bioavailability concerns, difficulty with studying them, that there's actually different phytonutrients and components of each plant, depending on where it is grown and harvested and what part of the plant is harvested. So there's really a lot of logistical complex issues with studying the botanicals. So I like this picture where you see the capsule. right? And the capsule's stuffed with food. And so food is the best medicine. We know that it's safe. And we also know that you get the whole plant, right? You don't lose the synergy of the plant medicine by boiling it down and taking a component out and putting that into a capsule. You're losing the rest of that plant. So if you're really undertaking this food as medicine approach, you're getting all the potential benefits of that plant. I do want to leave with you again if you choose to do botanicals, to do it in a safe way, to discuss it with your doctor, and to be sure that you get good quality products. And so there's a few different stamps of quality that you can use for your reference here: USP, Consumer Laboratories, NSF. These are good stamps of quality products. And this is really interesting that there's a lot of natural products that inhibit the pathways that we know are active. And so I'm focusing in again on MPNs here, that the JAK-STAT pathway is what we're trying to modulate, right? This is what our ruxolitinib and other JAK inhibitors are targeting, but there are also many natural products that do this as well. There's resveratrol, which is the active component in grapes, curcumin, the turmeric component of the spice in Indian cooking, capsaicin, it goes on, cardamom, and look how similar they are to ruxolitinib. And so really interesting. So I think this is a double-edged sword in that we need to really appreciate that natural products can be medicine, but they can also have the toxicities associated with therapy, just like a true pharmacologic agent can. So we have to be respectful of that. This is the SIM study. This is a survey of integrative medicine and myeloproliferative neoplasms that we had the honor to publish last year. And in the study, we looked at 860 patients with MPNs, and we found that they're using a broad range of integrative modalities. Physical activity and nutrition were in there, but also massage, yoga, acupuncture, meditation. Excuse me. What I found was really interesting is that natural products were used in the prior 6 months by about half of the ET patients, 42% of MF patients, and 45% of PV patients. So natural products are truly being used, but 20% are not reporting this to their physician. So really highlighting the need for more communication. If you find something on the internet or a friend recommends something, be sure to be taking that information and discussing it with your hematologist or your family medicine doctor as well about what you're interested in and what you're doing. Only 24% received nutritional advice on this survey. And again, I think that highlights that we need to be really highlighting the importance of this lifestyle as medicine. And 80% of the patients in the survey felt that their integrative needs were not heard by their provider. So I think we need to do a better job as your doctor to talk to you and to facilitate this kind of conversation. What were the top botanicals that were used in the survey? Vitamin D, multiple vitamin, magnesium, omegas, calcium, turmeric, green tea, vitamin E, medicinal marijuana, and mushrooms. And what was interesting is that only the omega-3 supplementation correlated with a lower MPN symptom assessment form and the brief fatigue inventory. Now, these were correlations, and so we really need a randomized controlled trial to support the use for symptom burden management, but we found this association quite interesting. We also looked at other associations for MPN, symptom assessment, form, quality of life, and depression. But again, these were investigational, looking at correlations and patterns, and we need more data to support which kind of modalities are used for which purpose. So I think the take-home study points of the SIM survey was there is a high need for integrative education and research. And so important is the need to communicate with your provider about these different modalities that you're interested in. This is another study that we're doing here at the University of Arizona, utilizing a mobile application to promote wellness. This is readily downloadable for free on the App Store at this time. It's My Wellness Coach. And we wanted to investigate if this was effective and if it was feasible in the population. So we asked 30 participants with MPNs to download this app and to set up 2 wellness goals. And then we asked questionnaires at the baseline 12 weeks after they have completed some interaction, at least, with this mobile application. And what we found is that about half the patients set up at least 1 goal. We were hoping for 2. About half patients were retained after that 12-week intervention, meaning that we lost about half as well. But interestingly, those that kept up with it and were really utilizing the application had an improvement in their total symptom score. We did not yet see any impacts on their sleep, diet, physical activity, but we are planning another phase where we're also going to be partnering with some laboratories to do biomarker assessments for inflammation. But for you now, this is a free resource that you can download and experiment with to optimize your wellness. And it's not MPN specific. So what I'd like to do is to summarize what we've talked about today. And again, thank you so much for the time and the honor to talk about these different points. Number 1, I think this is the most important. Discuss your treatment plan with your providers. Tell them what you want to do, what your goals are, and what kind of modalities are interesting to you, and how can you do that in the safest possible way, particularly with the botanical medicine. Eat intentionally, eat joyfully, eat the rainbow of colors, eat plentiful omega-3 fatty acids, eat where it truly is becoming part of a meditative process every day for you to enjoy your food. Move often. Get up, get moving, really evaluate where you are and be kind to yourself. That if you're not up for running a marathon, that's okay. Just get up and walk around the house several times per day and make small goals to get it a little bit farther the next day. Try to integrate some strength and some meditative movement if possible. To breathe, to focus on that 4-7-8 breathing pattern if that works for you, but if not, there are many others out there. Look at the different apps that are available to you, see if those resonate with you, and try to get into that kind of quiet, stress-free zone. Again, managing stress, being aware of your stress patterns, sometimes even setting a reminder on your smartphone, so checking in, am I in a stress response right now? And if you identify it, trying to release it. And then finally, cultivating joy. Joy is good medicine, and have an intention and a commitment to practice joy every day. So again, I want to thank the organizers, Dr. Deeg, University of Washington. It's been an amazing pleasure to be part of this program over the last couple of years, and I hope it continues. And thank you to the MPN QOL study group and to the Aplastic Anemia and MDS Foundation. You do amazing work, and it's an honor to collaborate.